Hey guys, Medaware, in partnership with Block Malaria Africa, the Nelson National and the Nelson Universe chapter, is lending its voice with the general populace to commemorate with the World Malaria Day. We'll be giving you basic information about malaria and preventive measures.
So what's malaria? Malaria is a febrile illness caused by the Plasmodium parasite, which is transmitted through the bites of a female Anopheles mosquito. Malaria is curable and preventable, but if without proper treatment, this can lead to a serious disease which can be fatal at times.
Nearly half of the world's population is at risk of contracting malaria. In 2022, it was estimated that 249 million people contracted malaria in over 85 countries, while 608,000 people died of malaria. People who are more susceptible to contracting malaria parasites are children, infants, and pregnant women, and people living with AIDS and HIV.
Malaria is more prevalent in tropical and subtropical countries, with most of its cases and deaths in the African region of WHO, and it's mostly caused by the Plasmodium falciparum parasite. This parasite is also found in regions like the Southeast Asia, the Eastern Mediterranean, and the Southern Pacific. Malaria is highest in post-Saharan African countries, with Nigeria at its top. Nigeria has 31.1%, Congo has 11.6%, Niger has 5.6%, and Tanzania has 4.4%.
Okay, so talking about the symptoms of malaria, 10 to 15 days after infection, we can begin to see some symptoms which include pyrexia, which we all know as fever. And some other symptoms might include headache, diarrhea, vomiting. On contacting the infection, in some cases whereby the malaria parasite is endemic, they might develop temporary immunity to it, and because of that, they might not be able to see the symptoms as early as others. So the best way to better know that you are having malaria parasites or malaria infection is to go and have a diagnosis.
Talking about the diagnosis of malaria, WHO recommends that once one is suspected of being infected with malaria, one has to be diagnosed within 24 hours to avoid malaria complications such as invading the various organs in the body. We have microscopic diagnosis and we have rapid diagnostic testing, which has to do with detecting the antigen of the malaria. The microscopy examination, that's the typical examination for diagnosing malaria, which has to do with detecting the parasite in the blood smear. Then we also have serological tests where we check out for the antibodies that have been generated by the body against the malaria parasite. It also involves clinical evaluation, like the clinicians examining the patient. So those are the integral part of diagnosis.
Can malaria be treated? Yes.
So malaria can be treated with artemisinin-based combination drugs, with that ACT. A lot of people have been drug resistant to this, but with the use of this drug, they can actually outscome it, and within the first 3 days, the malaria parasites are gone.
This is a vision of the World Health Organization and the global malaria community to have a world free of malaria. This vision can be achieved by countries completely eliminating malaria from their territories and also enacting laws that will prevent the re-establishment of the transmission of this malaria parasite. And we also can help in destroying all the breeding spaces of malaria around our homes and our surroundings.
When we talk about the prevention of malaria, you can see both the destruction of vectors and chemical prevention, but also prophylaxis. So malaria can be prevented by the destruction of vectors when we use long-lasting insecticidal nets together with chemical sprays for our homes and our household. So chemical prevention also comes into play when we use drugs to prevent malaria.
In terms of vaccination against the malaria parasite, RTSS has made a vaccine that effects and up-to-date show effectiveness against this parasite in young individuals living in areas from moderate to high transmission. This vaccine is effective against the parasite Plasmodium falciparum, which is the most deadly malaria parasite globally and most prevalent in Africa. In 2019, Malawi, Kenya, and Ghana has led up the campaign of administering this vaccine in selected areas coordinated by the World Health Organization. This vaccine has been shown to be safe, effective, and feasible using routine immunization services.